Every year, millions of people around the world experience a heart attack. Understanding what really happens during a heart attack can save your life or the life of someone you love. A heart attack, also called a myocardial infarction, occurs when blood flow to part of your heart muscle suddenly stops. Your heart is a powerful muscle that pumps blood throughout your entire body. To do this job, your heart needs its own blood supply, which comes from the coronary arteries. These coronary arteries wrap around the outside of your heart, delivering oxygen-rich blood to the heart muscle. When one of these arteries becomes blocked, the heart muscle begins to die. This is a heart attack. So, what causes this blockage? The process usually begins years before the actual heart attack happens. Over time, a substance called plaque builds up inside your coronary arteries. This plaque is made of cholesterol, fat, calcium, and other substances found in your blood. As plaque accumulates, it narrows your coronary artery, reducing blood flow to your heart. This condition is called coronary artery disease, or atherosclerosis. For many people, this happens slowly over decades without any symptoms. But during a heart attack, something dramatic occurs. The plaque inside the artery suddenly ruptures or breaks open. When this happens, your body responds by forming a blood clot at the rupture site. This blood clot can completely block the coronary artery, cutting off blood flow to part of your heart muscle. Without oxygen-rich blood, that section of heart muscle begins to suffer damage within minutes. The longer the artery stays blocked, the more heart muscle dies. This is why getting emergency treatment quickly is absolutely critical during a heart attack. Now, let's talk about the symptoms. The most common heart attack symptom is chest pain or discomfort. Many people describe this as pressure, squeezing, fullness, or pain in the center of the chest. This chest pain often lasts more than a few minutes, or it may go away and come back. But chest pain is not the only warning sign. Heart attack symptoms can include pain or discomfort in other areas of the upper body. This includes one or both arms, the back, neck, jaw, or stomach. Many heart attack patients experience this radiating pain along with chest discomfort. Shortness of breath is another common heart attack symptom. This can occur with or without chest pain. You might feel like you cannot catch your breath even when resting. Other heart attack symptoms include breaking out in a cold sweat, feeling nauseous or experiencing vomiting, and feeling lightheaded or dizzy. Some people describe a sense of impending doom or extreme anxiety during a heart attack. It is important to know that heart attack symptoms can vary between individuals. Women, older adults, and people with diabetes may experience different or less obvious symptoms. Women are more likely to have shortness of breath, nausea, vomiting, and back pain or jaw pain instead of typical chest pain. Some people experience what doctors call a silent heart attack. This means a heart attack occurs with very mild symptoms or symptoms that are mistaken for something else, like indigestion or muscle strain. Silent heart attacks are still dangerous and cause permanent damage to the heart muscle. If you or someone near you experiences heart attack symptoms, call emergency services immediately. Do not wait. Do not drive yourself to the hospital. Emergency medical teams can begin treatment on the way to the hospital, which saves precious time and heart muscle. While waiting for help to arrive, sit down and try to stay calm. If you have been prescribed nitroglycerin, take it as directed. If aspirin is available and you are not allergic, chewing one regular aspirin can help by preventing the blood clot from getting larger. When you arrive at the hospital, doctors work quickly to restore blood flow to your heart. They may use medications to dissolve the blood clot. These clot-busting drugs work best when given within the first few hours of heart attack symptoms starting. Another treatment option is a procedure called angioplasty. During angioplasty, doctors thread a thin tube called a catheter through your blood vessels to the blocked coronary artery. They then inflate a small balloon to open the artery and restore blood flow. Often they place a small mesh tube called a stent to keep the artery open. In some cases, doctors may recommend coronary artery bypass surgery. This procedure creates a new route for blood to flow around the blocked section of the coronary artery. The amount of damage a heart attack causes depends on several factors. The size of the area supplied by the blocked artery matters. The length of time between the start of the heart attack and treatment is crucial. Whether you have other blockages in your coronary arteries also plays a role. After a heart attack, the damaged heart muscle forms scar tissue. This scar tissue does not contract like healthy heart muscle, which can affect how well your heart pumps blood. This is why preventing heart attacks and getting quick treatment when they occur is so important. You can reduce your risk of heart attack by managing key risk factors. High blood pressure damages artery walls and accelerates plaque buildup. High cholesterol contributes directly to plaque formation in your coronary arteries. Smoking damages blood vessels and increases your risk dramatically. Diabetes increases heart attack risk because high blood sugar damages blood vessels over time. Being overweight or obese puts extra strain on your heart and increases other risk factors. Lack of physical activity weakens your heart and contributes to other risk factors. The good news is that many heart attacks are preventable. Eating a heart-healthy diet rich in fruits, vegetables, whole grains, and lean proteins helps keep your arteries clear. Regular physical activity strengthens your heart and improves blood flow. Maintaining a healthy weight reduces strain on your heart. Managing stress through relaxation techniques, adequate sleep, and healthy coping strategies protects your heart. Avoiding tobacco in all forms is one of the best things you can do for your cardiovascular health. Limiting alcohol consumption also reduces heart attack risk. Regular checkups with your doctor allow early detection and treatment of risk factors like high blood pressure and high cholesterol. Taking prescribed medications as directed helps control these conditions and prevent heart attacks. Understanding what really happens during a heart attack empowers you to recognize the warning signs and act quickly. Remember, every minute counts when it comes to heart attack treatment. The faster blood flow is restored to your heart muscle, the better your chances of survival and recovery. If you found this information helpful, subscribe to our channel for more health education videos. Share this video with your family and friends because knowing these facts could save a life. Stay healthy and take care of your heart.